Hello there, folks. It is Facebook Friday, attempt number 3 to get it on the air.
Third time's charm.
Dr. Keenan must not have fed the mouse. The internet keeps going out. So we gave him some food, and hopefully we'll make it through Facebook Friday here on the 3rd attempt. Dr. Gordon isn't here today, so it's Mark and Linda, and we have a special guest. Her name is Brooke Huguenard, and she's the new IVF nurse here at Southeastern Fertility. Both our Southeastern Fertility families and our NDDC families will be meeting Brooke. So good to have you aboard. Tell us a little bit about yourself, where you come from, and why you wanted to be here.
Well, I initially came from Alabama. My husband and I got married in this area. We got engaged in this area, so we always knew that when we settled down, we wanted to be around the Knoxville, Tennessee area. And I had a big heart for infertility, and so I had been in labor and delivery for 8 years and wanted to transition to a more clinic infertility setting. So lo and behold, y'all had a job opening, and here I am.
Well, welcome. And Knoxville is a great town. It has Buddy's Barbecue and other nice things. To me, Buddy's Barbecue is the main reason that it's a nice town. Well, Linda, what do you want to know about Brooke?
Well, Brett, I did want to say not only did we have an opening, but we called her back and asked her to come in before she got married. So, anyway, we were very needy, and we were glad to get Miss Brooke.
Sorry, Facebook. I accidentally dropped the phone for a second there.
It's okay. Kaylee's shooting today. You're doing just fine.
It's live. You can't say you didn't drop it.
Oh, I caught it.
Butterfield.
So Brooke, you've done some nursing in what, labor and delivery, you said, and
Only labor and delivery pretty much for 8 years. I was a staff nurse at Huntsville Hospital, which is in Alabama, and UAB. I did both of those for roughly 2 years, and then I travel nursed for roughly 3 years on and off, which is pretty much where I was a labor and delivery nurse, and I would take contracts at different places across the U.S., and I would stay there for 3 months while their need was strong, and then I'd move to the next place and relearned everything again. So
oh wow.
it gets a little exhausting.
That would not be for me. I like to know where I'm going, where everything is. I like my habits.
Linda doesn't like change.
I do.
Except for when new people come on board. She does love
I
that.
love those changes.
So now tell us about your family. So you're married? Do you have kids? That sort of thing?
We have 3 dogs and 1 cat who thinks she's a dog.
Trust me. Don't get me started on the animals. I know what it's like. It's worse than having kids.
Oh yeah.
Yeah.
One acts like a 2-year-old, one acts like a 5-year-old, and
Oh,
one's like the mature, good, perfect child. So.
You guys are busy then. Don't have any kids as long as you have that many animals. That's my only advice to you. And get rid of the animals at some point. Life will be a lot easier.
Well, I'm sure my husband would toss out 1 because she's the bad child, but we love her.
So I wanted to before we go, we have these. Linda and I have our awesome NEDC 1,000 babies coffee mugs. We're touting these all around the office because we're so happy.
Brooke gets one.
Brooke will get one for appearing on Facebook Friday today. They're awesome. We're just really thankful to God that we were able to pass the 1,000 baby milestone.
Yes,
We're well
that's
over it now. And we also have donuts today. So that's a nice looking little prop. They smell great. And the main reason, we had an abundance of donuts today. We had
Until we've eaten them all.
2 boxes from Dunkin' Donuts and 2
Courtesy
from
of-
the Donut Palace in Oak Ridge.
Courtesy of
Well,
Brooke.
well, that's what
and courtesy of Chrissy.
Christy, our front office person. So
And they smell wonderful.
they do smell great. And Kaylee, get a shot of this. This is really why I wanted to have the donut prop. When we walked in, this is what we saw. Brooke
How
got
sweet.
these donuts from the whole office saying,
Wow.
"Thanks for teaching me, quote unquote, all the things." There's a lot more to learn
A
about
lot more we're going to teach
this.
Brooke.
But we've taught
We'll
you.
try not to scar her, though.
Yes, we've taught you all the things so far. Wait, let's end it on this. If there's one thing you're really looking forward to in terms of treating the patients, what would you say that would be?
Well, the infertility patients that I've worked with in the past, one thing I really love about them is they're so grateful and they're so hopeful. And a lot of times in society right now especially, we've kind of lost that positive hope and gratefulness. So just being able to connect with the patients, because I know labor and delivery's gotten a little rough out here. And they're really busy, and there's a lot going on with COVID and everything. So, you know, being able to have that relationship back with your patients and connect with them and see the joy and the hope and be with them through all the different stages that they go through at this clinic.
Awesome.
Dust off that Nobel Prize. That's a whole inspiring thing I've heard in a long
I
time.
know, right?
Brooke, you're going to fit in just great around here.
The Nobel Prize of Hope.
Thank you for clarifying. So, you will be seeing Brooke when you come to Southeastern Fertility. Make sure to say hi and tell her thank you for the donuts. They've made the rest of us a lot happier today. Dr. Gordon should be back next week with the pre-Thanksgiving edition of Facebook Friday. For now, for Linda, for Brooke, for everybody else here, Mark Mellinger saying adios.